Hello, my name is Elena Staines. I am an author of Medical Cannabis in the United States, comparing 2017 and 2024 state qualifying conditions to the 2017 National Academies of Sciences report. This article will be published in Mayo Clinic Proceedings, Innovations, Quality, and Outcomes. We studied the qualifying conditions used to certify patients for medical cannabis in each state and found that every state approves medical cannabis use for conditions that lack evidence of being effectively treated by this drug therapy. We created this study because now that most states in the United States have legislation for medical cannabis, its effectiveness for treating medical conditions becomes more and more important. We set out to compare the qualifying conditions, also known as QCs, approved in each state for medical cannabis with a robust body of research on the subject, which is the National Academies of Sciences, Engineering, and Medicine report published in 2017. This report compiled known evidence of effectiveness of medical cannabis for 20 of the most popular qualifying conditions in the country and gave each condition a rating of evidence. We found a substantial difference tenfold in how many qualifying conditions states approved, rating from 5 to 52. 5 states, being Maine, New York, Oklahoma, Virginia, and the District of Columbia, currently require no qualifying conditions. They leave the decision to approve a patient for medical cannabis entirely up to the provider. In 2024, 97% of states had at least one QC with substantial or conclusive evidence, but only 8.3% of all the QCs in the country had this level of evidence. We found no significant difference in categories of evidence between 2017 and 2024. That means states added conditions from all groups, whether it be substantial evidence, moderate evidence, evidence of ineffectiveness, or even insufficient evidence. Many states added conditions since 2017, but not one state removed a condition from their list. Of the top 20 QCs in the country in 2017 and 2024, only one, chronic pain, had substantial or conclusive evidence of effectiveness. 7 were rated as either limited evidence of ineffectiveness or insufficient evidence. These were ALS, Alzheimer's, epilepsy, glaucoma, Huntington's disease, Parkinson's disease, and spastic spinal cord damage. So what does this mean for clinical practice and patients? Providers and patients both hope that clinical practice is based on evidence-based medicine. When we look at the results of our study, we see big gaps in evidence-based practice. In every state, providers were recommending medical cannabis, which is a drug that is not without adverse effects or costs, for conditions that have little or no evidence of being helped. This uncertainty isn't something we afford to other medications or therapies, so it's unusual that we allow it here. We highlight in the article how states go about the process of approving conditions, and many allow input from general public opinion, as well as from patients that believe they have been helped by medical cannabis. Our takeaway from this work is that medical cannabis research has a long way to go. Those who want to study medical cannabis have many federal barriers to face in order to complete that research, which is a big reason our knowledge is so far behind. However, as medical cannabis legislation continues to evolve and rescheduling of marijuana becomes more possible, we hope to see our evidence base catch up to clinical practice. Thank you.